The Prime Minister of Sweden got in trouble for saying exactly this, that he's using AI. And he's using AI not because to write his speeches or anything, but to say to him, what have I missed? What have others done? And that's what I use for my dad. I literally said, here are the problems, here's the surgery. It didn't give me the answer, it just organized it for me in an emotional moment where my brain was not computing. Welcome to the AI Ready Doctor podcast. It's so good to have you.
Thank you so much for having me, Hassan.
Today we are joined by Karla. She's a friend of mine. She is a patient experience expert. And we're going to be talking about how AI is reshaping the entire patient experience. Have you had any recent dealings as a patient or as a patient's family?
Of course, with my grandmother, whom I call my abuelita. She's like my second mother, really. She helped raise me. And she's aging, at 82 with some chronic issues and recently with some back spinal issues. AI couldn't have come at a better time for us as a family.
Really? Because I experienced it as well. This is not just any hospital. This is where my father has been hospitalized. And I've had moments where I was just at the registration or when the doctor comes in to talk to you, or you're wondering if the results on that CAT scan is really as bad as you think it is.
Yeah.
Those are moments where I turn to AI. How about you?
Same here. So my grandmother, she's part of the silent generation, as they call them endearingly. And she typically, I think culturally, she comes from a place where the doctor's always right. Just tell me what I got to do, doc. I'm coming at it from a place of let's speak up. Let's ask those questions. Do you truly understand what the next steps are, Grandma? Or are you relying on the fact that, okay, whatever comes next is just the absolute truth? So I like to approach it with my own family and with my own grandma from a place of what are all the options considering your whole history? Because this specialist, this surgeon might only know a fraction of right now what is happening, but they don't know the whole story.
What I call it the second opinion. Now it's 24/7 in your pocket.
Absolutely.
And I found a lot of physicians don't know how to deal with that. When it came to the results, there is the issue of trust. And I know you and I had so much conversation around trust in AI. Tell me a little bit about what you're thinking.
Yes, I think right now, based on the conversations I've been having, both at conferences, with clients, and with my own family members, that lack of trust has been there pre-pandemic, but even more so now. I know a recent Barrel Institute study came out stating that only 34% of Americans actually trust healthcare. And
that's a low number.
That's a very low number. When we think about that, and when we think about AI in healthcare, it's not only the mistrust and that skepticism, the healthy skepticism in AI, it's also the fact that patients don't trust healthcare to begin with. So it's a matter of how do we involve them early on in these AI tools, both by showing them how it benefits them, who is behind the AI, and ultimately how it can help their outcomes, help their quality of life.
Do you think that it is equal across all generations?
Absolutely not. In fact, this recent Barrel report that I'm referencing shows that the younger populations are even more skeptical of AI, which makes sense, right? We're more familiar, some native users of technology. I think it further highlights the fact that we haven't done a great job at engaging and truly building that foundational trust with patients, especially those younger ones, where they're seeing technology take off in other aspects of their life, with a click of a button. We can shop, we can get reminders But why is it that in healthcare we're so far behind? And I don't blame them.
I think, at least from the clinician's perspective, we have the oath of protecting the patient. And so we feel as though before you give me a solution and then I'll go look for a problem, let me tell you what the problem is and look for the solution for that problem. This should not be reversed. The shiny object may be shiny for a minute, but at the end of the day, we have to go back to the patient and say, what are the pain points? At the registration, get my name right. When you are collating the history for a patient from all of the previous records, I need you to get it right. Do you know that for the first 5 years of my practice, I found out that it was recorded that instead of bronchoscopies, I was doing sigmoidoscopies, which is a GI procedure. And that's because somebody, a human error, made a mistake for the code, the number that is used. And so imagine laying out AI on a system like this, broken. You're only going to automate brokenness. You're not
Right.
solving problems. From the patient experience, the first time they have an encounter with AI, whether it's in the ER, whether it is in the hospital, it's in the clinic.
Mm,
Have you had conversations with hospital systems? I know you've been on conferences around the United States.
yes.
What are the most common conversations you've been having with patients?
So the recent conversations I've been having around AI with clients that are healthcare organizations and decision makers are saying that there is some of that hesitancy and worry about AI taking jobs and AI not being able to, replace humans, which is absolutely spot on. It will never replace us. That eye contact, that sense of trust, that's something AI will never be able to replicate. That sense of trust and warmth and caring and compassion. And what I find myself in these conversations that I've been having is how can we think about leveraging AI truly to take all the stuff we as humans don't really need to be doing. What do I mean by that? The administrative tasks, right?
Yes.
As a physician, I'd love to hear your perspective of what percentage of your time pre-AI was spent in doing documentation.
We joked that it is a moral injury for us that we went to medical school to care for people, but the time that I take care of a patient is about a third of the time that I spend doing documentation, searching for things, even clicking away to find the information to help our patients. So you're spot on. That's where AI shines, is in automating the administrative tasks. And those are able to integrate trust. Now, AI can't feel pain. AI is not the one touching the hand of a patient to reassure them. So I echo what you've heard from others during these conferences and so on is we want AI to not take the human part of healthcare. When we are discussing costs of healthcare, isn't that just another cost laid on top of an already unsustainable system?
Absolutely. I think healthcare costs, first and foremost, in the US are the highest that they are anywhere. So with AI as an investment, sure, it's an upfront investment. However, in the long term, I think we need to think long term, what is this actually going to save us? And specifically, what is it going to take away? Like we just spoke about the administrative, all those the busy tasks that caregivers shouldn't be spending time on, and actually focusing on the aspects of care that matter most, which is the communication, right? The caring aspect of I see you and I know your history so that I can give you the best care for the best outcomes. And aren't Readmissions, for example, aren't those already costly enough to hospitals? Aren't the huge turnover rates that we're seeing in the medical field because nurses and doctors, they're completely leaving, some are completely leaving the field, right? So burnout among clinicians and not even burnout, you mentioned that moral injury of, you're spending so much of your time in front of the screen, whereas you could spend that time actually connecting and focusing on the things that you probably got into medicine to begin with.
Another aspect that you had mentioned to me, and I brought it in a lot of conferences, is this really a solution to a systemic problem? Or are you just creating another surveillance system so that you can maximize the benefit? Patients want solutions for AI, but they do not want an AI designed only to maximize finances without finding solutions for the problems that they encounter. You and I had discussed about this potential for surveillance. Tell me what you think or what you've heard.
Yes, what I've been hearing is, of course, there's changes in the current climate, right, that will incentivize adoption of AI in healthcare, particularly in rural hospitals. And that hesitancy and skepticism from patients of, how can I really trust AI? Who's really behind it? Who is it going to benefit? Is it profits over patients type of moment? Or is this really going to help me with my health? And one thing that I had mentioned to you was that sentiment of Big Brother, right? And what I mean by that is, there's a lot of talk about remote patient monitoring and wearables,
Yes.
right? As a tool for both, clinicians to be able to monitor and predict, wow, is patient's heart rate is a little abnormal. Let's check in with them type of thing. Or, it's, I do see both sides. I see the patient's perspective. Majority of patients feeling like, where's all this data going? And it seems like every day when we tune into the news, there's a new health breach, a new data breach happening.
Goodness.
So there's I don't blame patients for feeling. And I know a recent study showed that patients are reluctant because of that one key aspect of that privacy, that confidentiality. Where is this data going to end up?
So I guess the question becomes, and I doubt that a lot of people know that, who owns the data?
Patients absolutely own that data. There's no question about it.
So don't they know it?
Fortunately, the conversations that I've been having, both at conferences and with clients, that knowledge is just not there.
And how do you think we can actually show them or educate them? What is the best way to educate them?
A wonderful starting point would be engaging patients, whether it's through a PFAC, Patient and Family Advisory Board, where hospitals, healthcare systems, clinics are showing patients what is actually there and how they're using the data, how it benefits patients.
So transparency.
Absolutely. Transparency is key. And it's no doubt that patients don't fear AI. They fear being treated like a data point.
So their data, we need transparency as to how it is used. How can we enforce that?
How can we enforce
transparency?
I think being upfront of how are we using this data of, for example, you mentioned scribes, right? You mentioned scribes. And what is scribes doing, right? What are scribes doing? They're taking the notes in the background.
Yep.
And being transparent could mean, hey, I'm using this technology so that I could focus on this conversation, so that I could focus on asking you these questions that are going to ultimately lead to the best assessment, right? The best diagnosis and next steps. So transparency is really being clear. What are we using?
So informed consent
Mm-hmm.
in the setting of transparency. I'm thinking about it from the perspective of, let's say that it is OpenAI and they just wanted to enter healthcare, which they are. How can we enforce transparency with a company like this, which is entering healthcare? And as a physician, I have no control over what they do, what we call the black box of AI. How does AI process that information? What of that information is retained and what is only used for training and then discarded so that it's not posing a threat to a patient? We are not allowed to look under the hood.
I think that's where data governance really comes into play of before health systems really adopt AI, or maybe some are already in there. It's not about who implements AI the fastest. It's who can build those governance structures around how that transparency is being regulated and enforced, right? For example, recently in a conference, there were some doctors, like yourselves, who were talking about this data governance of how do we ensure that patients understand how, number one, that we're using it, and number two, how it's going to ultimately benefit them. And I think it ultimately comes down to that data governance that I was mentioning and engaging patients early on, not after the fact. Not after the fact where, okay, we already used it and, here you go. No, it's how are we using this data to ultimately help you and your outcomes in your healthcare?
Surgeries. How do you see AI changing the patient's experience in surgery?
Lovely question. First, on the patient side, I'll speak on that from a personal level, as well as what we're hearing from patients nationally, is even the preparation aspect. We need to inform patients of how they can use AI right now, as far as learning about the procedure, right? For example, if my grandma who needs, her spinal surgery, we could, and by we, I mean I can teach her, I can help her think about what to expect, right? What kind of surgery is this? And ultimately, what are the risks? So that she can understand and come in fully informed about what exactly is this procedure going to entail, both during, but more importantly, after. What comes after?
But isn't that the doctor's job?
It absolutely is, but that's not the reality that we're seeing, unfortunately.
Interesting. Because when I share with physicians, that is exactly the fear, is AI to replace us.
Yeah.
And what do physicians tell you when you visit those healthcare systems to improve the healthcare experience in those systems?
So physicians, it varies, but physicians normally want to get to the point, right? And you mentioned earlier about spending so much time charting in front of the screen that it's not that physicians don't want to have that conversation, that thoroughness and assessing the patient's understanding and barriers, but it's just not happening because of the immense pressures that are already on top of physicians' shoulders and caregiver shoulders. So these conversations of what are you afraid of? What concerns you the most about this surgery?
To be replaced.
Yeah,
by
to be
AI.
replaced by AI. There was a study recently that showed that patients actually liked the after visit summary when it was transcribed by a scribe. It had more empathy in the notes and it's more clear for them to understand compared to the regular notes. So it's not that AI is replacing that communication, that important communication. It's enhancing. It's really
Integrating.
It's integrating these critical points that perhaps the doctor wanted to talk about, but ultimately because of time pressures and productivity pressures, it's just not happening. So AI will not replace doctors by any means, but it will enhance this communication, this critical communication.
Many doctors will tell you, any doctor who doesn't do this is just incompetent. So I don't need AI for that.
Yeah, I've heard that sentiment as well.
Yeah. So I know that you've been in many conferences recently, you've had conversations with patients, with healthcare administrators, with doctors even. And you had some very interesting things to share with us. So tell me what you brought with you.
AI is not going to replace your doctor, your nurse.
Is that so? So when doctors ask you and when nurses ask you, I'm afraid it's going to replace me, what would you tell them?
Absolutely not. AI will not replace your doctor or your nurse. That human connection, that eye contact, that gentle touch on your shoulders, that joke that perhaps that joke that your doctor might crack is never going to be replaced by AI.
I love this. So AI to automate administrative tasks, but the humanity of healthcare will always stay ours.
Absolutely. And the way I see it is in the future, that human touch, that human element is going to be, and it is, the most valuable thing. But now with AI here, that's going to be even more valuable of, wow, can I talk to a real person?
Many of us, when we call on customer service and we get a machine answering, we just say, I want to talk to a human being.
Yes.
We're already there. So I can see where you're saying the human touch will always be human and can never be replicated in a code. So
Yeah.
when we talk about AI predictive analytics, it's more about you can give it a lot of data and it finds patterns.
Mhm.
So where do you think that this is important to educate patients and colleagues and your own clients about it?
Yeah, well, the best patient experience isn't better emergency care. It's never needing emergency care. And that's what predictive AI does.
So finding those patterns and trying to solve the root cause.
Exactly. Finding them, identifying them before they become a tragedy, like a heart, right? Let's talk
What if
about
those predictive analytics were used by insurance companies to deny service?
a great question.
And we're starting to see that. Insurance companies are using AI to discuss whether it's even worth authorizing something that has a chance of no success. I mean, just think about it. Life insurance. They have their own algorithms, and if you don't fit in them where you can give them money without them ever having to pay you back, if it's more than that risk, they don't want to work the risk.
Yeah.
So do you think that that is a real risk for predictive analytics with AI?
Absolutely. We would be naive not to think that these algorithms might be used in the favor, right, of these insurance companies. And how do we overcome that? I think that's the question, right?
As a patient experience advocate,
Mhm.
if you were in a congressional hearing right now and you were asked, what solutions do you see around you that you could offer as a consultant?
Well, an insurance company can blame an algorithm for denying your cancer treatment, right? But somehow they never blame the algorithm when they collect your premiums.
That's a good one. So how can we make sure that an algorithm does not code in it the biases against healthcare, against ethnic background, against perhaps various health issues and deny you service?
That's where patient advocacy and transparency is going to be key. Ensuring that at every step of the way, when we're integrating AI, when we're using it with patients, that patients are having a seat at the table. Where are the patients?
So one thing that is very important that we discuss often is AI is its diet. If we feed it biased information, it would give us biased answers. And the fear now is if AI is integrated in healthcare, won't it make decisions that we already do not like even more, such as denying healthcare services by insurances?
Yes, you're absolutely spot on. Where we have standards already as it is for hospitals, for physicians, these audits, the same standards or even more rigorous should apply when we use AI in claims and ensure that these biases don't shadow our decision making. Unfortunately, that's where some some AI models have shown these biases. I know you've posted about some of these, and I think that's where ensuring that the patient's voice is included and not an afterthought.
And that's where you come in.
Exactly.
You know how to prompt.
Yes, I do know how to prompt.
Tell me about the prompting. What have you prompted recently that when you did it, you say, that is definitely something I know?
With my grandma, going back to my grandma. For example, her surgeon said, no, you're not a candidate for this spine surgery because of all these comorbidities and, you have diabetes and all these other things. I asked AI, okay, you are a orthopedic surgeon, top orthopedic surgeon in the country. And you have this patient who is an 82-year-old Hispanic woman with all these, comorbidities. Since surgery is not an option, what are her options? What should she explore? What should she ask her doctor so that she can have some relief for her pain?
Do you know that the Prime Minister of Sweden got in trouble for saying exactly this? That he's using AI. And he's using AI not because, to write his speeches or anything, but actually to say to him, what have I missed? What have others done? Tell me the counter argument. And that's what you're saying. You used for your grandma. And that's what I used for my dad. I literally said, here are the problems. Here's the surgery. Here's the counter argument. Put them in a visual in front of me and help me decide based on risks and benefit of each so I can have a visual. It didn't give me the answer. It just organized it for me in an emotional moment where my brain was not computing.
Yeah, absolutely. It's such a powerful tool, but you need to know what to ask. And
so that's the question. You do actually know how to prompt.
I would say so.
So you do have some knowledge of AI.
Yeah.
That's the thing, is most people actually think that it's about becoming techie when it's actually just know how to talk to it.
Yes.
So you can derive from it. I don't need to know how the car works in order for me to know the basics to drive it, an oil change or a tire that needs to be rotated. I don't need to know how the technology of the car. If I were to throw at you a rapid fire.
Yeah.
Let's do it this way. AI and patient experience. Breaking bad news to patients.
100% human. AI can't.
Scheduling a follow-up.
Machine all the way. Let the bots do all that work no one wants to do.
Patient education material.
Both. Bot and human verified.
Right on. Asking, how are you feeling today?
100% human.
But even AI can do it, so why not?
AI can do it, but what is AI going to do with that? Humans can have that connection of, hey, how are you doing? How are you actually doing? What's AI going to do with that?
The humanity of it cannot be coded. I'll take it.
Humanity cannot be coded, yes.
Collecting feedback after discharge.
What we do now is humans first, and they do all the follow-up. But where we see it going is bots doing it, and then only escalating those that require that human follow-up.
Okay. And saying thank you?
Humans.
Every time.
Every time.
Well, listen, thank you so much. Thank you so much for that. I guess curiosity is infectious. Catch it here at the AI Ready Doctor podcast. See you next time.